always gas, fecal matter, coordinate. So gas that scatter the ultrasound wave, and we are unable to see the details of the gastrointestinal tract by the ultrasounds. Whereas when there is a lipid medium, we can see quite conveniently behind the lipid medium. We see the gynecological examination by making the urinary bladder full, because the urinary bladder provides a window to see the uterus and the next uterus. The propagation velocity of the various tissues is different, but as a whole we take a constant, and we assume that 1514 meters per second is the average propagation velocity in the tissue of the ultrasound waves. Now there are various terms which we should be familiar before while doing the ultrasound examination. The echogenic mean brightness. Whenever there is term echogenicity, it means brightness. When I will say it is hyperechoic, it means that it is more brighter. It is more better because it scattered the ultrasound waves more than the adjacent tissue, so it looks more brighter. As you can see here, there is the urinary bladder with urine in it, and this is a stone inside. The stone being more denser, that reflects the ultrasound wave as well as absorbs the ultrasound wave, so it looks more brighter as compared to the urine in the urinary bladder, so it is hyperechoic. Whereas hypoechoic means that it is less bright than the adjacent tissue, as here is the liver and the right kidney. The liver is brighter than the right kidney. The right kidney is hypoechoic or less bright than the liver. So echogenicity means brightness, hyperechogenicity means it is more bright, and hypo means that it is less bright. The isoechogenicity means of equal brightness, as you can see here in this picture. This is the liver and spleen. Liver and spleen, most of the time they are isoechoic to each other, of equal brightness. Sometimes spleen is hypoechoic a bit, but most of the time these both are isoechoic to each other. Anechoic or echo-free is the region which show no internal echoes, mean that looks black. When the ultrasound wave passes through a fluid medium like here in the gallbladder, like here in the urinary bladder, all the ultrasound wave they pass through as such. No reflection takes place, and when there is no reflection, no glimpse or dots will produce, and that substance or structure will look anechoic or echo-free. Anechoic or echo-free. So anechogenicity means there is no echo inside. Another term being used is the acoustic shadowing. The marked reduction in the intensity of the ultrasound due to a strong reflector or attenuator is termed as the shadowing. The shadowing behind the stones, calcification and bone is caused primarily by the sound absorption by these structures. And you can see here, this is the femur, this is the bone, and ultrasound waves that strikes the bone, they either get reflected or absorbed in the bone. There is nothing, there is the efficiency of the ultrasound wave behind, and that produces a shadow which is known as the acoustic shadow. Here is the kidney, and there is a stone with shadow behind. So a hard substance like stone or bone will reflect or absorb the ultrasound wave and will produce a deficiency of ultrasound wave behind, and that will produce a shadow which is known as the acoustic shadow. Another term is the acoustic enhancement. The strong reflections are the interfaces due to a cystic structure because of less attenuation to a fluid make the posterior wall of the fluid containing substance more brighter, and this more brightness of the posterior wall of a fluid medium, that is labeled as acoustic enhancement, posterior transmissions or through transmission. As you can see here in the urinary bladder, all the ultrasound waves they pass as such through the fluid of the bladder, they get reflected only from its posterior wall. So the posterior wall looks more brighter as compared to the anterior wall, and this is labeled as the posterior enhancement. And this helps us to differentiate between the cystic and solid structure. As you can see here in the kidney, you can see a cystic area. This is the renal cortical cyst. See the walls of the posterior wall of the cyst that is brighter than the soft tissue of the kidney. This is the soft tissue of the kidney. This posterior capsule is not so bright as here. So this more brightness of the posterior wall of the region, that is called the posterior enhancement or true transmission. Another example is here the unibladder, this is uterus, and there is a fibroid on the right lateral wall of the uterus, and you can see that bladder posterior wall is more echogenic as compared to the posterior wall of the fibroid. So in this way we can differentiate between a solid and cystic substance. Another term is the edge shadowing. Edge or lateral shadowing is seen due to the edges of the rounded structures when sound waves glass के विधम की round substance is different from the recent tissue. यहाँ पे अल्ट्रासोनल आती हैं, edge से वो थोड़ी सी deflect हो जाती हैं, and there is the efficiency of the beam behind, so it produces a shadow behind, and that shadow is known as the lateral shadow or the edge shadow. So these are both two terms. The transducer or the probe of the machine is the key component of the machine, and a transducer is any device which converts one form of the energy to another. In case of ultrasound, as I have already told you, there are crystals inside the transducer, the piezoelectrical crystals, and when electrical current strike the crystals, electrical energy is converted into sound energy. And when the sound pulse is coming back from the various crystals, they strike the crystals, they produce the electrical energy. So transducer is a device which converts one form of the energy to the other form of the energy. And it is the principal component of the scanner, and transducer both produces as well as the receives the ultrasound waves. The frequency of the transducer is variable, and they come in a variety of the frequency. Routinely used ultrasound transducer which we use for abdominal ultrasound examination, the frequency used in those instruments is 3 to 3.75 megahertz. And if we increase the frequency, there will be the more penetrations. For obese persons, we require lower frequency transducer, because as we increase the frequency, the penetration of the tissue will be more, but the resolution will get lower. So higher the frequency, the lesser is penetration and better is the resolution. But if the frequency is less, the penetration is more, but resolution becomes poor in those cases. So lower frequency probes, they are used for obese persons, and high frequency probe, they are used for the superficial structures. The transducer, there are two types. Either they have the single element piezoelectrical crystal in them, or they have the multiple element piezoelectrical crystal inside. Those with single piezoelectric crystal, they are not used these days, they are obsolete, and routinely which we use, they are the multi-element transducers, and we also label them as array. The array transducers, they are configured in various types. Either they are phased array or sector probe, the linear array or curved array, or the convex probes. As you see here, this is the phased array or sector probe, where it steers the beam so that a sector image component is produced, and because the length or the probe surface or the surface which is in contact with the patient, that is smaller, so it is used for those areas which have the limited soft tissue, as while doing the echocardiography we have to put the probe in between the ribs. So for echocardiography we use the phased array transducers. And the disadvantage is that it has the near field vision. This is the near field, this is the far field. So when we use the sector probe, the near field is give the poor vision, where the far field give the good visions. The linear array, in this transducer, individual elements, they are arranged in a linear fashion so as to produce a rectangular image format, and these are commonly used for small parts and vascular and the obstetrical ultrasound examinations. And major advantage of the linear array probes is high near resolution and so a large superficial field of view. And you can see here the linear probe, high frequency linear probe, they are used for superficial organs like scrotum, breasts, RR examination, and for vascular examinations with cardiology assessments. As you can see the flow in the vessel by the high frequency linear probes. So the linear probes, when they are high frequency, they are used for the superficial structural evaluation. The curved arrays or the convex probe, the surface of the linear arrays deform to a curved or convex shape, and it results in a wider far field but reducing the resolution of the probe. And curved probes are either with small radius, as you can see, this is also called the microconvex probe, this is the convex probe, and this is the endoluminal probe. All these are having the convex format, and